Welcome back to the New York State Department of Health Clinical Education Initiative's Building Blocks for Trans and Gender Diverse Care series. My name is Erica Bostic, my pronouns are she, her, and I'm an adolescent medicine physician and faculty for the CEI Sexual Health Center of Excellence.
And I'm Kai. My pronouns are he and him, and I'm a clinical educator for CEI.
Welcome to the final episode of our Building Blocks for Trans and Gender Diverse Care series. We hope you've enjoyed your time with us so far.
If you've been with us from the beginning, you've seen us cover LGBTQ affirming language, the stresses associated with the trans experience today, the beauty and the vibrancy of the trans community, how to make your workplace more gender affirming, how to establish a team that can help you meet that goal, how to conduct a gender affirming medical history, the various steps that a person might take in their transition, and how you, as a medical professional, may or may not be invited to help them through that journey, how to prescribe hormone replacement therapy for trans men, trans women, and those who identify as non-binary. And now, we're going to end our series by talking about keeping our trans patients healthy for the long term.
Specifically, this involves much of the same preventative screening as for cis people, but let's get into it in more detail.
Let's talk about body parts. Basically, if you have a body part that could become unhealthy in any way, we should be monitoring that. This can be awkward for trans folks and for trans healthcare providers, but that doesn't mean it's not important.
Let's go back to our organ inventory. As a refresher, it is a way to take stock of the body parts a patient has before and after gender-affirming surgeries. If a body part is there and guidelines exist that recommend screening, they need to be on your radar. To name a few: chest. Whether or not someone has had top surgery, there still needs to be some form of monitoring based on the various guidelines for breast cancer screening and prevention. This may need to be modified. For example, ultrasound instead of or in addition to mammography. Where there is mammary tissue, there is a risk that that tissue can develop cancer. For example, around the areola or towards the axilla. Remember, for those folks who may have a higher risk of breast cancer for various reasons, it is important to refer to a specialist who may follow more specific screening guidelines. Basically, regardless of sex assigned at birth, we follow guidelines such as the USPSTF or ACOG or others as a cancer preventative strategy.
Also, when we're talking about the chest, it's important to be aware of some practices that people might use to modify the way that their chest appears. One common practice for trans masculine folks who haven't had top surgery, for example, is to bind. There are a number of different ways to bind the chest. Not all of them are created equal from a safety point of view. Some people use commercial binders, which is a garment that you can place over the breast tissue to flatten it and give your chest more of a masculine contour.
Even if you're using a commercial binder, there are still safety practices that need to be put into place. For instance, binder-free time. If you wear a binder 24/7, you can have significant skin irritation or even breakdown and infection.
Also, our bodies aren't meant to be constricted for 24 hours a day, 7 days a week. So if you're wearing a binder 24/7, you're going to get out of breath. You might even pass out. So it's important that your patients know that they should take breaks from using their binder and should never try to work out while wearing a binder. But there are some folks who don't have access to commercial binders. They might not be aware that they exist, they might not have the money to buy them, or they might be afraid that a parent or someone else is going to find the binder if they order one in the mail. So they might resort to using non-commercial options by picking up other items around the house and trying to use those to constrict their chest. A common one is ace bandages. These are meant to compress different body parts. And so logically, some people think they are the perfect solution for binding their chest. Unfortunately, they can be really dangerous because as the body pushes on an ace bandage to force it to expand, it comes back and constricts even harder. So as a person breathes in, that's putting pressure on the ace bandage to expand, and it's going to constrict even harder. So every time someone breathes in, the bandage is becoming tighter and tighter. And they might not even realize it, but it's going to start really constricting them and make it hard for them to get adequate oxygenation. It can also cause some skin breakdown, just like a binder. And then lastly, what you definitely don't want to use is duct tape. It's really appealing because it's everywhere. It's in your house and it's cheap, And it can do a really good job of getting the breast tissue nice and compact, but it can cause some serious skin breakdown, and so it should definitely be avoided.
The cervix. We follow Pap smear guidelines for trans folks with cervixes, the same as we do for cis folks. Of note, for those on testosterone, there likely have been genital changes that may make this exam more uncomfortable.
Okay, so let's talk about Pap smears. They are uncomfortable for just about anyone, but they can be particularly uncomfortable for trans guys and other people with a cervix who don't identify as cis women. So what can we do? Well, first, the number one most important and sacred rule for all physical exams, but particularly for this sensitive exam for trans guys, is no means no. If a trans guy or a non-binary person is getting a Pap smear and they just cannot tolerate it and ask you to stop, you absolutely need to stop. You might not get the sample this time around, and in the grand scheme of things, that's okay. What's really important is to keep that relationship between patient and provider intact and to ensure that there is trust so that your patient keeps coming back. If your patient is able to tolerate the Pap smear, there are some things that you can do to just try to make it a little less miserable. So you can allow them to bring in a support person, a friend or a family member that they really trust to help keep their mind off of what's going on the other side of the drape. Also, you can be really clear about the role of a chaperone. Some people, some practices require that you have a chaperone in the room anytime you're doing a sensitive exam, just to make sure that everything is above board and that everyone is protected. But for a trans guy or non-binary person getting a Pap smear, having anyone else in the room that doesn't need to be there can be threatening or just uncomfortable. So make it really clear why that chaperone is in the room, and if there's anyone else in the room who doesn't really need to be there, like a student, as much as we love education, this is just probably not the time. There are some other techniques you can use to help your trans patient be distracted during this difficult exam. So allow them to bring in a Game Boy, or maybe allow them to use their headphones, as long as they aren't noise canceling, to listen to music or a podcast, just to take their mind off of what's going on. You want to be quick to try to get it over with, but you want to make sure that you're being thorough. You want to make sure that you get an adequate specimen every time. Because as bad as it is to go through a Pap smear, it's even worse to get a call that says, the sample didn't cut it, we got to do it again. Another great option is to try to use the smallest speculum you can. So a pediatric speculum might be the perfect fit for the job. Make sure that you're using a good amount of lubricant. And if your patient is really anxious about this exam, a little bit of pre-medication to help alleviate some of that anxiety can go a long way. So many providers I know will prescribe a small dose of a benzo just to help calm some of those anxieties and nerves.
Prostate. These guidelines are ever changing, so your best bet is to follow the latest USPSTF guidelines. It's important to know in the first place if a patient has a prostate, and that way you can guide your monitoring based on that.
Next up is anal health. This is important for everyone, and maybe particularly so for some patients depending on their sexual practices and family history. This is a little outside the scope of this video series, but if you want to learn more about anal health, go to ceitraining.org, where you can get more information and watch videos on this important topic.
Bones. Sex hormones protect the bones. Very important. There are existing guidelines for cis females regarding bone health screenings, usually via a DEXA scan. This is something you want to be familiar with for those on feminizing hormones, but also to consider if a patient is inconsistent with their hormone use or is off hormones and for a period of time may not have had therapeutic levels for either of the sex hormones, especially if the gonads have been removed.
Next up is penile health. Just like for the chest, some trans folks might use some practices to try to change the way that their pubic region appears if they're wearing clothing like a skirt. So someone who has a penis might use a practice to tuck it back and out of the way so that there's no noticeable bulge. There's a lot of different ways that someone might approach this, but some of them involve using glues or duct tape. As you might imagine, this can be really irritating to the skin around the penis and scrotum. And so it's important to talk to your patients to make sure that they're using practices to keep that skin healthy. Similarly, some trans men and non-binary folks might pack, which means to use a prosthetic so that it appears as though they have a bulge where a penis would normally be in a cis man. Just like for trans women who might tuck, it's important that people are taking care of their skin down there. So if they're trying to apply that prosthetic with glue or tape, you want to know about it so you can make sure that they're using appropriate strategies to keep their skin nice and healthy. Lastly, let's talk about silicone. As we've mentioned before, trans people have been through a lot over the course of history between themselves and healthcare professionals. Most of the time in that history, trans people have not been taken seriously by healthcare professionals. And so only really recently have healthcare professionals started to partner with trans folks to help them establish the body that best represents who they are. So when people didn't have access to healthcare professionals to modify their bodies in a safe way, they found alternative solutions, many of which are really harmful. One of them is silicone injections. Silicone injections just mean that someone used some sort of filler, they might not even really know what it is, and injected it into different parts of their body to try to make them look more round or full. This is more common in trans women who might try to inject silicone to establish greater breast tissue or to enhance their hips. Silicone injections, unfortunately, have a lot of negative side effects. That silicone, though injected in one part of the body, can travel into another part, causing some serious damage, like major infections, pulmonary embolism, stroke, and even death. Okay, so we've talked about body parts and all the ways that we need to watch them to keep them healthy. Let's talk about harm reduction. So cis people and trans people and non-binary folks all engage in behaviors that sometimes have risks associated with them. And one of our jobs as healthcare professionals is to guide them towards safer behaviors and away from ones that can cause more harm. So let's start by talking about the number one health risk that impacts the LGBTQ plus community. Erica, any guesses?
That must be HIV, right?
Good guess, but no. Try again.
Suicide.
Wrong again. Suicide and HIV get a lot of attention in the media, but actually the number one health issue that impacts LGBTQ plus folks is smoking. And this isn't by accident. Tobacco companies have a long history of specifically targeting the LGBTQ plus population. In a memo called Project Scum, Subculture Urban Marketing, a tobacco company high-ranking official noted that populations like the LGBTQ plus community that are ostracized by society are easier to target than others. And so they made their presence known at pride parades and by taking out advertisements in magazines, and the result has been pretty impressive. The queer community and LGBTQ plus folks at large tend to smoke more than their cis and straight counterparts. Now, ultimately, a lot of the conversations you're going to have with your trans patients about smoking are going to look really similar to the conversations you have with cis folks. Many of the risks are the same. It might be worth noting, though, for some of your trans feminine patients who might be on estrogen, that increasing their risk of VTE is one of the side effects of smoking while on their feminizing regimen. And so that alone might be a reason to cut out the habit.
So when counseling about initiating HRT, it is important to know if a person is also smoking. If someone is contemplating smoking cessation, there are many resources and medications to help people do this with innumerable health benefits.
All right, next up, let's talk about reproductive health and contraception. Erica, I've got some questions for you. First, is testosterone birth control?
No.
What about estrogen?
Well, in someone that produces eggs, yes. In someone who produces sperm, no. As previously discussed, prior to starting HRT, you should have had a discussion about parenthood intention and fertility preservation. If someone does not intend on becoming a parent in the near future, it is important to discuss ways to prevent this from happening. There are plenty of contraceptive methods that a person on testosterone can use if they have a uterus and are having sex with sperm-producing partners. Hormonal methods involve progesterone-only contraceptives, including LARC methods, like an IUD or progestin implant, Depo, or a progestin-only pill, and those are in the order of efficacy. Of course, condoms serve dual purpose of pregnancy prevention as well as STI prevention. Of note, trans women can also use condoms if they are the insertive partner.
On the topic of sex, let's talk about PrEP and PEP. A surprising amount of people are unaware that there's a way to prevent HIV through medication. This currently comes in the form of 2 different pills, both including tenofovir and emtricitabine. We have countless ways of learning more about this through CEI and several presentations on PrEP and PEP alone at ceitraining.org. Suffice it to say that patients living with HIV can absolutely undergo hormonal transition, and patients that are on HRT can safely use PrEP and PEP for HIV prevention.
You have now completed the entire New York State Department of Health's Clinical Education Initiative's Building Blocks for Trans and Gender Diverse Care series. Thank you for sticking with us. We hope that this was a fun and informative experience for you.
We've given you everything you need to get started. You aren't an expert, but that wasn't our goal. Don't let perfect be the enemy of the good. Wherever you are, there are trans people who could benefit from your help. Even if you're not ready to prescribe hormones or do trans-specific medicine, just being the provider that they can count on to use their affirmed name and pronouns will likely go a very long way. I encourage you to put these things into practice and enjoy it.
I did not go to medical school to study trans medicine or do a residency in this. I learned this over time and have found it incredibly rewarding. You can learn it and do it. The first time you prescribe to someone or sign off on a letter to have a body part removed, you may be scared. You may face resistance from people who just don't get it. And that also can make you question if you're doing the right thing or the wrong thing. I want to validate these emotions, but remind you that despite this, you are an integral part of someone's journey to becoming their authentic self. And that is one of the greatest privileges that I can think of in medicine.
Thanks for spending this time with us. To learn more about trans health and so much more beyond that, please visit ceitraining.org.